Welcome to 2026, and I hope that you all are not getting frozen out there. I'm in sunny Florida and it's still in the 30s right now. So be careful and don't let the frost bite you. Today, we're going to talk about a very timely uh, information about what's going on with this new flu season. And so this flu season is super difficult and widespread because it's complicated by a flu bug that has mutated, so it is particularly more virulent. So 90% of that is from this new flu bug and is more infectious for children and of course the elderly and causes some more severe symptoms. So that resulted in 19 million illnesses to date, 250,000 hospitalizations, and 10,000 deaths so far. So it is probably more dangerous than the COVID that everybody was worrying about before. So, of course, uh, if you want to prevent flu symptoms and hopefully if you catch it, it's not as bad, you should all get a flu shot. Not everybody wants a flu shot, but so I'm just going to give you all who really should have a flu shot back in October or November of last year. So you probably should get the new flu shot in October, November this year if you have not gotten it. The high risk population include children that are from 6 months to 5 years, all pregnant women, the elderly that's greater than 65 years old, especially those with chronic diseases like diabetes, asthma, and lung disease called COPD. Anybody who's taking immunocompromised medications, and all nursing home residents should have the flu shot. It is the best way to prevent severe flu symptoms, hospitalization, and death. You'll still get sick, but not as bad. And like everybody else, if you want to boost your immune system and keep it healthy so you can fight the flu bug, then you should always have good, nutritious food, keep your exercise going, have a good night's sleep of 7 to 8 hours, and not get stressed. You all know that if you're stressed out, anxiety, depression, you get sick more often with viruses. So you always remember this is a good habit for everyone. Wash your hands for 20 seconds or use a hand sanitizer if you can't get to the water source. And try not to touch your mouth, your nose, and your eyes while you're traveling because that's where the flu bug can be transmitted to you. Now, a lot of people say, I take lots of vitamins. I should be healthy. Well, here are the ones that actually show to temporarily boost your immune system when you travel. So, or during this flu season, you say, I want to take medication to protect me better. The vitamin D, the zinc, and the garlic has fairly decent data that it boosts your immune system. Echinacea is only to be given for 1 week and not longer than that. So if you want to travel, you probably should take the echinacea 2 days before traveling and finish the echinacea 2 days after you come back. Now, a very popular medication called curcumin, there are no data against flu, and vitamin C, been off, on, and at this point, there's no good data that it really prevents the flu. So let's talk about symptoms of flu. Well, the typical symptoms that everybody know, you got fevers, you got chills, and then you got muscle aches everywhere. Okay, even your hair and your head would hurt. Additional symptoms due to this new uh, flu virus that has mutated also includes nausea, vomiting, diarrhea. So this is a difficult symptoms to combat. Okay. And so you caught it. What should you do? Well, you should stay home. You should stay away from other people so you don't get them sick. And you have to pay attention to how much hydration you have, especially if you're having diarrhea and vomiting. You should rest up a lot so your body can fight the virus. And I've already shown you the high-risk group on the slide 2. So go back and look at it, because if you are a high-risk group, you got to call your doctor right away so it can put you on medications that can decrease the number of days that you're sick. Now, if you actually start to get shortness of breath or chest pressure or confusion, or you have diarrhea and vomiting that don't stop, you should probably call your doctor, and you might end up in a hospital. Now, what about if you have someone who has flu? Well, you should stay away from them unless you have to take care of them. You should stay away from every places that have lots of crowds, because some people with flu symptoms can give it to you. And during that period of time, or if you have to be a caretaker, you got to wear your mask and even gloves to protect yourself. And always clean and disinfect the surfaces that he or she uses, especially disinfect the phones and the computers, and wash your linens and clothes carefully and do not share. Now, this medicine called Tamiflu, it is only effective if you take it within 48 hours of the symptoms of the flu. So beyond 48 hours, it does not work, so you should not take it at all. Unfortunately, the side effects of that is the nausea, vomiting, headache, diarrhea, which the current flu has, but it's just not as severe. So again, remember, if you're in high risk, please call your doctor and start this medicine within 48 hours to decrease the number of days of sickness. In the nursing home, if you have a flu epidemic, everybody is having flu, then it will not be unreasonable to take a half dose Tamiflu for prophylaxis if you have not gotten the flu yet. And so you need to ask your doctor about all those things. So this is all I want to update you on flu, so you understand what you should do, when you should do it, and when to call your doctor, and when you call your doctor for Tamiflu. If you find this helpful, please give me a thumbs up and subscribe to our YouTube channel at Key Chan Connections. Okay. Otherwise, I'll see you in another month or so for another information video. Thank you very much for your attention.